I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Please forgive my broken tooth. I'm a little self-conscious. Today we're looking at a question of the week, and that question is, what can be done with uneven nipple pigmentation after top surgery? Now, this patient was talking about top surgery, which is the masculinizing surgery to change the shape and the size of the breasts to create a male-appearing chest contour. As with any surgery, it takes time for the body to remodel. It has to reduce the swelling and redness at scar lines, and it has to restore the normal coloration of the irregular tissue, which is the colored tissue around the nipple itself. Now, the pigmentation of the areola can take a year or two to return. Sometimes it'll look mottled or pale, but nipple tattooing can be a valuable option. So here's how I learned about 3D nipple tattooing. One day, a patient of mine who had had breast reconstruction after breast cancer surgery, she said to me, "Linda, come and look at my nipples." And she had had 3D nipple tattooing, and she traveled to New Orleans to get it done. This, by the way, was a cis patient in my practice. So what can 3D medical tattooing accomplish? Well, it's remarkable. It can color correct, and it can even out the variations in color or the hypopigmentation or the lack of pigmentation that can occur after surgery. It can create what they call hyper-realistic contours, like you see with pores or with hair follicles or little veins, etc. Now, here's an unbelievable example of this. So this person, if you touch the areola, it is absolutely flat, okay? But when you look at it, as in this picture, it certainly looks as though that nipple has projection. Medical 3D tattooing fools your eye so thoroughly that you have to really run your finger across that nipple to see that it's really flat. But it's a wonderful treatment. Another application for medical 3D tattooing is after phalloplasty, and that's the creation of the penis. Again, the results are amazing and greatly enhance the appearance and enhance the experience for an individual who has this surgery. So to summarize, if you are dissatisfied with the nipple coloration, or if you have hypopigmentation after top surgery, check into medical 3D tattooing to see if this technology might help in your situation. Now, here are two references. These are two names of people that I have contacted. The first one is Vinnie Myers, and Vinnie Myers' team did the nipple tattoo on the woman who is a patient of mine. And this is the woman who had a reconstruction after breast cancer, and she was then given new nipples by 3D tattooing. And the other person is Shane Wallen through Garnet Tattoo. Later on, when we're looking at phalloplasty, I'll show you some tattoo examples. It's amazing. I hope this information was useful for you. If so, please like my channel, tell your friends, because this information might help somebody else as well. Thank you so much for watching today, and I'll see you in the next video.